All right, can you hear me? Yep. Good? All right. Thanks for having me. I am going to continue on the theme of getting rid of stupid stuff and tried to start with bios, but I didn't catch that one in time. I am here because I got to meet a bunch of analytics folks from this special interest group earlier this year. So apologies in advance, but I'm going to call on each of you that were there as experts to weigh in on some of these topics, because it hasn't changed too much, but we have learned a lot through collaborating with some other health systems and doing some focus groups. I wanted to share some of that latest thoughts and thought leadership with you. I have been in healthcare my entire career, and there was some folks talking earlier today about reminiscing about how old they are and what it was like way back when. My first job in a hospital was the third shift in environmental services. I upgraded to a desk job about 9 months later in a cubicle with no computer. I had a telephone and a green bar printer, report printer. So I am an operator at heart. I put patient care at the center of everything that I do. About 15 years ago, I got involved in EHR implementations, and then I started to really appreciate that data is the lifeblood for how we understand our patients' wants and needs, how we understand what to design in order to serve them best, which is a great word that I love to use as well. And what I want to talk about today is what are we going to do to prepare for the impending future of data that is sitting on the shelf trying to figure out what to do with itself. There's a lot of staggering risks and fears and trepidation about what is the role of technology in healthcare delivery going forward. And what I want to level set on is how do we come together and look at transformational change at a high level that helps us and encourages us to think about what we do on a day-to-day basis and think about it differently. So I am a big fan of design thinking, so I was really happy to get to follow Dr. Joseph, because in analytics solutioning, everybody thinks they have the answer to solve problems, but they are not very good at articulating what that problem is. And part of that is just the culture of change management and the precedent of the people and the process that's involved in delivering analytic solutions. Much like physicians, data scientists with PhD in statistics like to think of themselves as the person with the answers, or that would be someone that you would come to with the right solutions. But a good data scientist, and there are good data scientists, and I'm not going to crap on data scientists the whole time, would enable everyone to be an analyst. They would think about how do we get information to where it needs to be thought of in order to make the best decisions, and do it on a repeatable basis. It's trusted and reliable, and that really enables everyone to make signal out of the noise that is the data in the EHR. We're going to talk a little bit about AI because it's on every banner in the room, so I think we're all thinking about it. And the change management aspects of that is really to think about how are we enabling our stakeholders to think about the differences in how we move forward in process improvement when we're talking about technology we don't understand. How do we need to speak about it differently, and how do we need to change the language and the conversation to do it effectively? So the problem statement that I haven't changed in a long time is that there's a tremendous amount of demand on our limited number of resources that are knowledgeable and have access to the right level of data and technology in order to solve problems. This is a problem that is not going to be fixed by hiring more data scientists. It's a problem that will be fixed by looking at your organization and understanding how decisions are made, prioritize, how you rationalize programs and process improvement opportunities against a technology landscape that is no longer a back office function. And so my challenge has always been to CIOs and CTOs and CDOs and all of those organizations in the health system to not take any more pressure from the organization, those in the organization that are speaking the loudest about the problems that they're having with technology solutions, and catering to those needs by thinking of yourselves as a support function that takes tickets and reads those tickets and tries to deliver a solution without having the courage or the proactivity to go walk the walk, go sit by the person that has the problem, go really observe, what is it we're trying to solve for and how can we think about it differently. And that leads to the people aspect of it. So in most organizations, if I think of the person that you go to most often when you're trying to solve a complex problem, like I know that we have a high number of people in our population that are dealing with multiple chronic conditions, and they tend to not go to their PCP for well check-in or whatever it might be. There's always that person that you can go to that has some magical access to the information to answer that question for you. This person has probably been in the same level of job in their career ladder for 8 to 10 years and has become respected as the person with the answers. My challenge to everybody is to think about opening the perspective on everybody in your organization that's curious about understanding what the data can tell them. And then the third thing is transparency. So that's been a theme in a lot of these talks today. But when it comes to new technologies, especially with advanced technologies using data, transparency is very important to mitigate some of the risks, to think about what are the proactive steps we need to take to understand how to speak about it differently, how to think about it differently in our organization. So we're going to talk a bit about that. So I've done a couple of focus groups recently, and these are some of the comments that were collected. And it's really interesting to think about how some of these things have not really changed too much over the past few years. But similar to what I was saying before, the skepticism about data accuracy in your organization is at an all-time high because the role of the EHR is changing. The role of how we measure performance, measure cost of care or outcomes is becoming more and more complicated. Most organizations are dealing with hundreds of standardized quality measures with categories of those quality measures telling you the same, different answers to the same questions. And it's supposed to be that way, and you're supposed to understand that length of stay can be measured 4 different ways. And that just creates more and more frustration around this centralization of knowledge capital that should be federated, and that centralization of the people that have the answers that should be federated. In addition to that, it feeds politics in the organization, and it feeds the role of ownership for having those answers. And that's not a capital asset that we want to control tightly. It's one that we want to improve the quality of so that it can be federated and owned by the organization that needs to make the decisions. So with that in mind, I have 2 takeaways. And this is the only thing you have to remember from this presentation. The thing I want to say is data is it's a valuable asset, and everybody, I think, appreciates that. But in healthcare, we actually, the statistics that everybody's probably heard is that in the world of data, the entire world, 30% of it is produced from healthcare. The World Economic Forum said that 97% of that is not usable. And so our mindset of the EHR being the cornerstone of transitioning from analog to digital with data and information is a great starting point that happened 15 years ago. Meaningful use and all of that was a great step forward towards something that should have happened that we failed to fulfill as we grew in our maturity for the reusability of data. And that is that it was a billing activity. The EHR at its core when it started it was intended to help us standardize the way we document what has happened in the past so that we can standardize how we categorize and segment payments and have a standard language around how we transact that. And then over time, it bolted on different things, different initiatives, and now we have a better picture of the patient through the EHR. But on a day-to-day basis, you're faced with and introduced to dozens of different ways in which we can articulate what is going on for that patient. You think about standard quality measures that have to do with, let's say, avoidable care. So patients go into the emergency department. We have a problem with capacity in the emergency department, and we manage the measure of that by just simply saying how many times should a person go to the ED per 1,000 patients, for instance. And that is a great starting point for a process, but it has nothing to do with the upstream cause of the ED visit. And then you start to think about imagining that the patient is at the center of improving a process, and you start to realize all the context around why they're there, what is avoidable care, what led them to show up at the ED, when did they show up, what time of day was it, what day of the week was it, and then you start to reveal all these different things that can become overwhelming, that paints a picture about, well, maybe this person is, has an uncomfortable environment at home, or it's very cold and their heat's out and they don't feel well, so the ED is a safer place for them. Or maybe there's a limited number of access points for them to just get basic care, and that becomes their medical home. And so we know all those things, but how do we quantify it at a level that's scalable in order to understand how to prevent that from happening? And then when I say everyone is an analyst, my idea is to just open up the concept that your organization is full of people with ideas that are curious about innovation and technology, what data can do for you, what it can't do for you. And we need to challenge our organizational culture to allow those folks to step up and be heard, to understand that there is a path for them to take their data curiosity into something that could be really meaningful and impactful for what they do on a day-to-day basis. And it doesn't mean that you have to go from being a frontline employee to going to get your PhD in statistics. There's numerous different pathways to get those folks in your organization involved in how we use data. And as we think about advanced programming languages, when it comes to AI, because we've started so heavily in large language models and the way that generative AI is being used today in our health systems, the statistics portion of it is actually working towards becoming more of a software development activity. And the primary programming language for reusing data is going to become the English language. It's not going to be Python or R or SAS. You're going to ask data questions, and the program that is going to provide the answer back to you is going to speak to you in English, in the English language, not in some sort of code that only a few select people can understand. So that's why it's important just to shift that mindset and understand that in your organization, everyone can be an analyst. And this quote from HIMSS is that it's not something that you purchase. It is treating your people with the level of curiosity that they have, helping to encourage and nurture an environment in which they can learn and grow. And so that leads to the organizational culture aspects of things. And so there's a ton of different challenges that exist today. One of the things that I often do when we go into a health system is help them inventory all the different governance structures that exist. What are the decisions that are being made? What level of authority do they have? And you quickly find a lot of redundancies and a lot of misaligned interpretations as to what the authority is of each of these levels of governance. And governance is a thing that just sounds like political, because it is. But the challenge for us is to think about governance as a place where the right voices are at the table that can be heard and synthesized around a strategic intent that is universal. And so when we're introducing AI, for instance, we have to understand that all of these different voices, the voice of the patient, the voice of the clinician, the voice of the end users, if they're not at the table to be able to consider what trade-offs need to be made when we're considering what problems to solve with AI, then we're not going to get anywhere with making meaningful change, because it's going to go back to those beginning comments, which is the loudest voice in the room is going to win, or the one that has the biggest price tag or dollar savings amount tied to it, in theory. And so in order to get to what characteristics make good problems to solve, we just need to arrange our governance, arrange our people, and the thinking from tactical to strategic. And so in analytics, the way to do that, and we've talked about this in the last session, but defining the problem, and we're not good at this in healthcare. One of the things that we have a hard time doing is thinking more linear around problem definition. So problems can be defined easily when it's something that you can quickly identify, you can feel, you sense it, you know, you can go observe the problem. But unless you're looking at it from a balanced perspective where there might be unintended consequences, where you change this one thing and this other thing is going to pop up like whack-a-mole. That's why the problem orientation really has to be thought of more around a journey of whatever the user, the end user or the consumer of information is experiencing at that time. And it looks like a series of questions. But the most important thing about a life cycle approach to problem solving is that it's iterative and it's very rapid. That concept of failing fast is really important, because what we're looking at is each step of the problem definition that helps to contextualize what's actually going on is going to reveal all of those other downstream, upstream impacts that we can have. It's going to teach you how to look at things from a different perspective and iterate on what that problem actually is. And so one way to think about that from an organizational perspective is the community aspect of people that are curious about getting involved in certain subject areas. So communities of practice are, it's just simply a way to say there's a group of people that are interested in one topic, one domain, and they want to get together and they want to talk about that certain thing. In most organizations today, that's not done unless there's some sort of mandate. We've got to get our mortality rate down because our CMS star rating is in the dumps. So we put together this group of people that probably are chiefs that sit around and try to figure out what we're going to do to improve our mortality index. And then they go to the analytics group and say, we need all this information. And then it continues the same conversation that we were just having. Well, what problem are you trying to solve? And so the amount of time it gets to get to the value of that problem is longer than it needs to be in order to understand where we're going to go. You're also asking highly skilled and trained analytics professionals to answer common descriptive statistic questions. The more time a data scientist is answering questions about how many people had sepsis last year, for instance, the less amount of time they're going to be building those programs that are repeatable, that provide self-service enablement that I talked about before that's so important to have at the front line. And so the way to think about it is if we have the amount of resources broaden to include everyone in the organization that might want to get engaged in data and information, and we equip them with what they need to understand, the language to use in working with data, or we give them access that we traditionally hold tight to in a centralized type of format, then we will open up the door for more innovation and more scaling of adoption and change management that's so important. So instead of feeding the business, the approach should be to teach the business to fish. And what you gain from that and these analytics communities of practice, just think of it as like a repeatable playbook that you can put in place, where it's not like an extracurricular or a way to get people together to talk about interesting things. It actually can be a way to execute on the huge demand of problems to solve with data in a way that's more efficient, because you allow the analytics function to develop tools that are reusable and to work on data governance and data quality to make sense of the business rules, the information, in a way that can allow end users that are not as technically savvy to be trained on how to use it effectively. And then you also will empower end users to understand that they are an analyst and the data is an asset. And so investing in data architecture, data governance, and everything that you need in order to make your data reusable becomes an easier story to tell. So with AI, I have been in data science for 12 years, I think. And there's never been this concept of thinking about how important information can be to just transform how we do medicine before now. And so it's a very exciting and scary time. And again, we've done a lot of asking questions to try to understand and level set where organizations are today and thinking about this. And you might imagine there's a broad spectrum of different feelings and concepts around this. But the first thing I wanted to point out was that when you think about your organizational readiness to change with AI solutions, asking the right questions is a good place to start. But if you put together all those different aspects of the people process things that I was talking about before, then you're going to find a lot of ease in trying to capture the tone of where people are at in their concern and their level of risks they're willing to take, and the areas in which we think we could start. And 9 times out of 10, you're going to find that the way we describe artificial intelligence is all over the map. And so thinking about these low-hanging fruit administrative workflows that can be looked at for opportunities to be solved with some sort of AI application allows you to get into the space to create a language that is acceptable and understandable and comfortable, and also get people engaged in thinking innovatively about what could AI be for our organization. Because the potential is broad. We have a lot of, obviously, waste in healthcare. Healthcare is broken. It's a $4 trillion industry, and maybe $1 trillion of those dollars goes towards providers trying to get paid or trying to compete, and payers trying not to pay you and also trying to compete. And if we imagine a world where it's patient-centered and we think about all the different ways in which we can center innovative technologies around efficiencies that can be scaled, that address these IHI 5 categories of waste, then maybe we're finally at a point where some of these things can be embraced and adopted and scaled in a way that can be effective. And so some of the use cases that I've been involved in creating and have seen out there, it covers a wide variety of things, but some of the attributes that are really important that I've seen is just recognizing that convenience and trust is the most important thing to a healthcare consumer. And so when our patients think about AI, they start to think about their phones, what's in my pocket that can help me, or they start to think about what they hear in terms of hospital at home or device monitoring. And that's all well and good, but there's a lot of other industries that are much farther ahead than healthcare in consumer-facing adoption of AI technology. What I've found and what has been far more successful in large organizations that are looking to do AI solutioning is that if we orient the problem solution fit for AI around a problem that's typically nebulous as far as who owns it, and it breaks down those traditional barriers of acute care, ambulatory care, population health, value-based care, supply chain, cost of care, finance, something that can encompass all of those things, and you're going to demonstrate the value of AI a lot more efficiently and effectively. And so the example I call out here with basically supply-demand problems in healthcare is a really good one. There's others that we can talk about, but this one I called out because it challenges you to think about something like capacity management as an opportunity to think about what triggers increased demand on a limited number of capacity in an acute care setting. And then you start to work upstream and you start to think about, well, how do we get the patient to our hospital door? It's a digital front door or an ambulatory front door, urgent care ED front door. And then we start to think about, well, how are we communicating to those patients in order to make the ability to see a specialist or get a referral. And so you have all this upstream work that really is about the consumer journey, patient engagement, communications, and the templates we use to prioritize scheduling of subspecialties and primary and on-demand care. And then downstream, you start to think about elective surgeries. Where are they going? What's the transitions of care? Are they going home? If not, how do we have continuity of an experience for the patient post-stay? And so then all of a sudden, like the capacity management hub of your acute care facility can start to look at the whole picture of a patient's journey through your system. And then you can start to understand why it becomes very complex and how AI can be a very beneficial tool to understand that and decode all the different patterns and opportunities for improvements with that. So the particular health system I was working with had a number of models to understand like the spaghetti model of patients moving through in and out of the system. And what they found was that the solutions to actually improve the problem of more supply or less supply than there's demand on their capacity was simple things like how you staff environmental services to clean a room for a terminal stay. When you do pre-surgical checklists, try to do it the night before the patient shows up at 7 a.m. for their elective surgery. Like the list of improvements that came out of the AI models that were developed in order to articulate what was actually happening were very simple things. And it becomes an eye-opener for the power of relying on augmented intelligence from different models in order to better understand what problem we're trying to solve, and that the improvements are not big and transformational, but they can be little and incremental and have a big impact. And back to the governance aspect of it, one of the things that is important is just make sure that there's communication that is consistent across your organizations that addresses the known challenges and risks. So there was a great quote, I think, in the opening keynote about clinicians that use AI will replace clinicians that don't use AI, to address that problem of AI is going to replace my job. There's fears of data security. There's fears of decision-making being forced on someone with limited metadata to understand what the suggestion is. All of this has to do with managing models in a way that helps the end user have safe and explainable ways to understand what they're doing. It is a computer model that can help improve what's in front of you to make a decision. So you can go from hundreds of variables to a few variables through AI to make a better, more consistent decision. That explainability, or the way in which we treat AI models, has to have a different perspective as far as knowing that AI models have to be trained. And the better you train it, the better data you have to train it, then the better employee it becomes for you. Because at the end of the day, if we think about AI as an additional human resource, then it becomes a little bit easier to digest. What are we relying on AI to do for us in the future? And so this goes back to consistently what I've been talking about before, but I wanted to pick on one particular thing here, which is data governance. So there's never been a better time to talk about what data governance is and how it can serve your organization than right now, because if we're not engaging in the experts of the domains and subjects of different data sources to contextualize what it's actually doing, then that context that surrounds data that's in our stored systems that can be reused will never be understood, because you're going to get dozens of different interpretations of what it actually means. And so another aspect of community of practice is data stewardship, and that's simply engaging in the person in each of the domains that produces data as an expert that has authority over certifying definitions of different data elements, data measures, what is good performance, what is bad performance. These are all things in healthcare that we've been dealing with for a long time. But if you frame it around the advanced technologies, the ability to use AI better, it's going to be an easier sell to say we don't have a structure in which we can hold ourselves accountable for what the data should be telling us and what it's actually telling us. And that's essentially what data governance is. And when we're thinking about the challenges in all forms of governance, then it again is another way to change the perspective for what are the typical silos and barriers that exist in each of the domains, and how can we break those down and think more simply and more globally about how to move forward with some of these initiatives. So for the sake of time, I'm going to jump to change management. So this is like a standard change management framework. We use this all the time in healthcare. It is a trigger for performance and process improvement. It is a way to make sure you're checking all the boxes for communications, knowledge management, training, and that you're engaging everyone in the same, getting them on the same page as far as what are we trying to do here in this initiative. When it comes to AI, this is a great place to start, but there are a few areas that I would recommend just considering a little bit differently. And so one of them I hit on a little bit, but the traditional form of how the IT organization serves your organization can be reframed and should be reframed. And the primary reason for that is there are going to be technology barriers that exist, and what something should be doing for me and what it actually is. And you're also getting faced with a plethora of new market entrants where there are risks involved, and these solutions either coming from a different industry or getting infused with capital, which I think it's something like 70% of all venture capital going into the healthcare industry today is some form of commercialized AI. And so we should be skeptical of that, but we should also understand what is the point solution versus platform approach to understanding how to orchestrate all the information and all the technology that's at the front line for helping us with our workflow. And that requires IT leaders to be at the strategy table. So when your organization, your board is setting priorities for what are the big rocks we're going to focus on, it needs to be done through that technology lens in order to safely progress in maturity for reusability of data. And the perceptions of AI will be, again, across a broad spectrum, but thinking about how to do it in a way that leads to better terminology and the way we talk about it, that needs to be fed into the change management communication tools, the training tools. How can we be sensitive to this various degree of risk and concern and plan for it proactively in change management? And then again, AI, and it's the nature of it, is that there is agency in the end user and their ability to use it effectively. And by that I just mean the way you present the information is important, but then the way the end user understands what information is telling them and how they're supposed to use it, or how they have agency to choose not to use it, is a way to tweak change management in order to be the most effective it can be. So I only have a few minutes left, unfortunately, so I'm going to pick one example. I'm trying to think which one's the better one. So I'll just do this one. So putting it all together, we're creating an opportunity for rapid characterization of a patient's journey through our system with these clues of a digital landscape that is being collected from all over the place. So with a combination of better data, data governance, platforms that can connect the dots between dozens and dozens of different interactions that your patients have with different electronic systems, it captures information, you're going to start to understand what things will trigger an engagement improvement or engagement opportunity. And so if you think about the context of, in this case, just what's the acuity level or the expectation of trust convenience that the patient or consumer has for your system, then you can start to understand that there are a lot of different variables that can be automated through AI in order to serve patients better that feels personalized, but personalized at scale. And so an example of how we've done that is thinking about the simple task of texting a patient within 24 hours of discharge from an acute care stay. Typically, those things are automated messages. It could be things like just a reminder of your discharge notes, in the portal. It could be something specific, like make sure you schedule your follow-up appointment. They're just little nudges that go out on a standard basis for those patients, just with the goal of continuing the level of care that you expected from that discharge. They went home because they were ready to go home. We want to make sure they're not readmitted. They don't go to the emergency department. How do we avoid that? But if you take the massive amount of responses that have existed prior to that, where they've got choices to answer, you can take a question like, do you feel better or worse than when you were in the hospital? And by simply taking the answers to that question and then putting them in a category to take some customized follow-up with, then you segmented a portion of the population that took their discharge notes and threw it in the backseat of the car when they were on their way home, and they forgot anything that was said to them in the last 4 hours of their stay. And there are critical pieces of information that are going to, at some point, occur to them, and and it's probably going to be at 8 o'clock on a Friday night, and so they're going to go to the emergency department. And those are things that can be prompted with simple decision tree AI models that can help your care managers, your case managers, or even the chatbot itself to speak in a way that is customized and can avoid those things. And it has a real impact. So in this particular example, a study of these hospitals reduced, on average, $12.4 million in avoidable ED cost savings. So I did have another example, but I'm getting the red card, so I will go to one question, maybe. Yeah?
Who is that device?
That's a good question. Okay, well, thank you very much for your time. I appreciate it.